Minister, you were made aware in September 2024 that Healthscope would end private maternity services, yet you waited 8 months before writing to your federal counterparts seeking additional funding or support. On the 7th of October 2025, only a week ago, Territorians heard on ABC Radio Darwin that the federal government is still waiting for the fully costed plan your office promised. Territory families and healthcare workers have been working together and offering up their own solutions to this crisis, yet you are still sitting on your hands. Minister, why has your office failed to provide a detailed, fully costed plan to the federal government? When will you get around to providing that plan to the federal government? And can you tell Territorians what is taking you so long?
Minister for Health.
Thank you, Madam Speaker, and I thank the member for Daly for this question. And I think it might have been last Parliament where I had to re-explain this to the member for Daly once again. But I don't think he likes the answers, Madam Speaker, because as we know right from the very outset, Healthscope's decision to close the Darwin Private Hospital was made late last year, and of course we know that maternity services ceased here in Darwin on the 6th of June this year. But leading into that time, the government has been involved in a number of measures to address the issue, to ensure that the level of private health service remains available here in Darwin, and as part of that we have been working at the operational level, been working extremely hard to ensure that the transition to Royal Darwin Hospital has been managed with the highest level of care. It's important to look at some of the statistics because roughly 8 years ago there was somewhere around 2,000 babies being born at the Darwin Private Hospital, and of course leading up to the closure by Healthscope, the number of births at the Royal Darwin was down to roughly about 250 births per year. But when it comes to writing to Minister Butler, what I will say is that the health officials have had many high-level discussions at the official level. I've not only spoken to Minister Butler, but have written to Minister Butler, I should say, to talk about these issues. But what we have seen is that the federal government certainly has a fully costed proposal, and those conversations with Minister Butler are ongoing. But what we haven't seen, Madam Speaker, is any support whatsoever from the member for Solomon, nor no support from the Labor opposition here in the chamber or outside of the chamber. Not one bit of support has been offered by Labor to lobby the federal minister to access money to improve maternity services here in the Northern Territory. What we've heard is whinging, complaining, but not once have we heard Labor or the member for Solomon on the front foot lobbying the federal minister to get better access to maternity services here in the Northern Territory. What we've heard from the member for Solomon is he wants to bring 𝙁𝘼𝙄𝙇𝙄𝙉 to the Northern Territory. Have you heard him talk about maternity services? No. Have you heard him talk about aged care? No. What I have heard from the member for Solomon is that he promised on the 11th of April this year to bring $60 million to build 120 aged care places here in the Northern Territory, but absolutely nothing from Labor.
Thank you, Madam Speaker. My question is to the Minister for Health. Minister, for more than a year, you've failed expectant Territory mothers and their families, ignoring their pleas for safer, better maternity services across the Northern Territory. You've spoken out on radio, in the media and at community forums like Our Birth, Our Voice, yet you've done nothing and continue to blame everyone else for your failings. While your Chief Minister and Deputy Chief Minister tell Territorians to leave if they don't back the CLP and dismiss or criticise health professionals, you've stood by in silence. Territory families and healthcare workers have been very clear. A lack of continuity of care is putting babies and mothers' lives at risk. Minister, when will you stop defending failure, apologise to Territory families and finally take some action on the crisis in NT maternity care?
Minister for Health.
Oh, thank you, Madam Speaker, and I think the member for Daly didn't listen last time, so perhaps I'll repeat once more. And I do want to put on the record the work that is being done right across the Northern Territory, Madam Speaker, because I know that our maternity staff, our frontline workers, and getting out and visiting the Alice Springs Hospital on the weekend, Madam Speaker, we have our frontline workers are doing an absolutely incredible job when it comes to delivering babies here in the Northern Territory. Now, as I said before, it was 𝙁𝘼𝙄𝙄𝙉𝙂 that shut down maternity services here in Darwin, and we stepped in to take over and provide a service that many mothers would have completely missed out on. So I've spoken many times before about the different packages that we introduced, and as of the 8th of October, Madam Speaker, 53 families have used the private maternity service packages, 21 families used the hotel retreat package, while 32 families have used the return home sooner package. But as of last week, all 61 of the privately insured mothers affected by 𝙁𝘼𝙄𝙄𝙉𝙂's decision to close maternity services have now given birth at the Royal Darwin Hospital. So it's reassuring and, but in the same way, disappointing to hear the member for Daly basically criticising our frontline staff for the work that they're doing to delivering birthing services here in the Northern Territory. But when it comes to delivering birthing services, what I will say is that we're getting on with the job. Our frontline staff are providing some incredible service at the Royal Darwin Hospital. But when it comes to money, Madam Speaker, and we just heard the member for Daly previously talk about approaching the federal government for $35 million to assist to upgrade the maternity suite, Madam Speaker. This isn't about capacity, this is about improving the layout of the maternity ward for mothers. But it's not just the 35, Madam Speaker. We've also been asking the federal government to assist with aged care services as well. On any given day, Madam Speaker, there's between 60 and 80 aged care patients in our hospitals right around the Northern Territory. And I ask the question, where is Labor? Where's Luke Gosling? Where's the member for Daly? Why aren't they out there advocating to improve aged care services here for families in the Northern Territory? But at the same time, it's costing us $40 million per year to deliver that service on behalf of the federal government. So how about getting out there and supporting us rather than carrying on?
The federal government boosted Territory Hospital funding by 30% this year to cut waiting lists and reduce waiting times in emergency rooms. Minister, Territorians are still waiting for hours in emergency for treatment while you stay silent. Meanwhile, you've scrapped critical infrastructure upgrades in remote communities like 𝙁𝘼𝙄𝙄𝙉𝙂, which puts continued pressure on our urban hospital systems. Once and for all, can you tell Territorians, both those needing care and those delivering care, if you have a plan in reducing wait times and for relieving the pressure in our hospitals?
Minister for Health.
Thank you, Madam Speaker, and I thank the member for Arafura for his question, because when it comes to delivering health services in the Northern Territory, again, I want to commend our frontline staff. And visiting the Alice Springs Hospital, when I had the member for Karama and the member for Blaine with me on the weekend, just getting out there and talking to staff on the front line is clear to me that the work that they do under significant pressure every day of the week is absolutely extraordinary. And that's what we're seeing from the front line right across the health service. And what I will say is that the member for Arafura touched on some of the remote services as well, and it's very important to recognise the remoteness of many of the health clinics here in the Northern Territory and the work that the staff are doing in those areas as well. But when it comes to wait times, when it comes to the pressure being experienced in EDs, not only in Darwin but also in Alice Springs, and we heard that from staff in Alice Springs, that they're under significant pressure as well, Madam Speaker, right across the Northern Territory. But the real question is, why are they under significant pressure right across the Northern Territory at the moment? And it's interesting to hear the member for Arafura talk about funding, because we've just received a hospital reform agreement offer that doesn't even get us to the national average. Doesn't even get us to the national average in 5 years. In fact, the offer on the table at the moment, Madam Speaker, has us going backwards when it comes to federal funding to run the health service here in the Northern Territory. Now, I've already spoken about aged care. Madam Speaker, aged care, between 60 and 80 aged care patients in our hospitals across the Northern Territory every day of the week is costing us $40 million, and that's a federal responsibility. The hospital agreement on offer over 5 years is going to take us backwards. We're already the lowest funded right across Australia at the moment. So the real question is, Madam Speaker, what has Labor done for the last 8 years besides drag us into the position that we find ourselves in today, the lowest funding, no new aged care facilities, not one
Take
new...
your seat, please, Minister. Opposition Leader, what's your point of order?
Standing Order 110. The question was clearly around what's the CLP's plan to reduce those wait times and the pressures.
Okay, please continue.
Because you haven't
Health
said
I
anything.
think I'm addressing that, Madam Speaker. What we need is aged care facilities here in the Northern Territory. Federal Labor promised it back on the 11th of April this year, and they failed to deliver any aged care facilities. We've got 60 to 80 patients in our hospitals, and that will take some of the pressure off our frontline staff, because it's all about bed access. Aged care people
Take your
should be in
seat, please,
aged care
Minister.
facilities.
Your time has expired.